Dear respected colleagues, today we present together a case of adenomyosis. What is adenomyosis? Uterine adenomyosis is a condition of the female reproductive system, which is a type of gynecological disorder and is characterized by the invasion of the uterine muscular wall by the endometrium. The average age of incidence for this condition is typically around 40 to 50 years old, with a prevalence in the general population of approximately about 20%. Generally speaking, these are women who have a history of endometriosis in about 20 to 80% of cases, or women who have previously undergone assisted reproductive techniques. Risk factors include multiparity and uterine surgery, with involvement of the junctional zone, endometrium, myometrium. What are the symptoms? Generally, women often experience chronic pelvic pain, dysmenorrhea, perimenstrual pain, and/or menorrhagia, such as heavy menstrual bleeding. However, in 35% of cases, it is also asymptomatic or has only mild symptoms. The symptoms may also possibly be related to a previous history of infertility. What are the ultrasound characteristics of adenomyosis? In clinical ultrasound practice, we have a set of criteria called the MUSA criteria that guide us and assist us in making a diagnostic suspicion of adenomyosis. Here you can see them listed. These are the main features that we can observe on ultrasound. Generally, we see an asymmetric thickening of the uterine walls. We may observe myometrial cysts or the presence of hyperechoic islands. And then we see what we call a fan-shaped shadowing, which I will show you in the following video. There may be lines, subendometrial buds, a translesional vascularization, which is also called comb-like, and in some cases a junctional zone, irregular or interrupted. Here instead in this slide we have included some images that can help you understand what these are. Let's say the features of the MUSA ultrasound criteria that we have just mentioned. In figure A, we can then see a difference in the thickness of the myometrium between the anterior and posterior uterine walls. In B, the formation of these multilocular cysts, these anechoic myometrial cysts. In figure C, instead, what we observe are these hyperechoic myometrial spots. In figure D, we can see the characteristic fan-shaped shadowing, that is, the so-called intralesional shadow cones, which are visible in the figure. Additionally, we can observe the subendometrial hyperechoic spots as shown in figure F. Here we can very clearly see this translesional vascularization, while in the last two figures we can see an actual and definite interruption. Segments of the junction, therefore myometrial, or an irregularity of the myometrial junction, can be observed. In the following video, I will carefully show you and explain some of these important ultrasound features in detail. Now I'll show you some images, so ultrasound images as usual. We always start by performing the exam transabdominally, that is through the abdomen, and then subsequently we proceed to perform it transvaginally. We perform the transabdominal exam specifically in order to rule out the presence of any masses or abnormal formations in the upper abdomen, in the upper part of the abdomen. Here we can already see a first part of the findings. In this area there are these hyperechoic or very bright spots located inside of the endometrium, and also some hyperechoic spots that are located more in the subendometrial portion. Here, as you can see with the arrow, we clearly indicate the endometrium. And those bright areas that you notice are the hyperechoic spots. In this particular case, it was a 40-year-old woman. She was in a periovulatory phase at the time of the examination. In fact, as we can see here, there is a trilaminar type endometrium. Now, we turn on the color Doppler, and we can already observe that we do not find the typical peripheral vascularization pattern characteristic of a fibroid, but instead we see a translesional vascularization. Here we switch to the transvaginal approach. The image is much clearer. We perform the hysterometry, and already we can observe that there is a difference in thickness. Between the anterior and posterior uterine walls, the uterus appears extremely globular, especially at the uterine fundus. We can already see these intralesional shadow cones. Here we move and observe, let's say, the entire myometrium. Here we see the endometrium again, and once more we observe the vascularization of the endometrium. We always make sure to take a clear and thorough look at both the right and left ovaries, which both appear normal in this examination. This is the left ovary. Then we measure this case. There is also a dominant follicle, which was on the left when the woman who came to our attention was seeking pregnancy. Here we can clearly observe these hyperechoic spots that are mixed in, so there are also some areas that are anechoic. Here I note that the uterus is globular, especially in the fundal portion. Notice the translesional type vascularization, which is also called comb-like vascularization and is very different from the vascularization of a typical fibroid. Uterine, because generally in that particular case the vascularization is peripheral, whereas in this specific case it is translesional vascularization. Here I'm showing you with the arrow these very small vessels that are interposed, let's say, between the hyperechoic areas. Then there are these anechoic myometrial cysts, which are the black ones seen on the image. Here I'm pointing one out to you with the little arrow for clarity. In this case as well, they are multiple anechoic cysts mixed together with hyperechoic spots, as you can observe. And here I'm showing you the fan-shaped shadowing, that is these intralesional shadow cones. In fact, right here you can very clearly see them forming these anechoic stripes, these black translesional stripes, which are different from those in fibroids, because fibroids are generally much more uniform. And then I actually showed you these hyperechoic spots later. So everything we have already mentioned earlier, when we listed the Musa criteria, still applies here, and in this case we measure both the anterior and the posterior myometrium. On one side it measures 28 millimeters, and on the other side it measures 17 millimeters. And so there is a noticeable and significant asymmetry in the anterior and posterior uterine wall, which is always typical of adenomyosis.